Intermittent catheterization is when a patient will pass a small flexible catheter through their own urethra to intermittently drain their bladder. It is used when a patient can't empty their bladder on their own. Intermittent catheterization is used in patients who have dysfunctional bladders, either from neurologic impairment, spinal cord injury, or other trauma with resultant muscular failure or neurological failure of the bladder. It's also frequently used in patients who have long-standing obstruction from benign prostatic enlargement, which has led to the inability to completely empty the bladder. When we have patients on intermittent catheterization, we ask that they use a clean technique to perform the catheterization. They first wash their hands and then wash off the urethral meatus. They use a small amount of lubricant on a small flexible catheter, which is then passed through the urethra into the bladder. This allows the urine to drain out of the bladder through the catheter into either a toilet or a urinal. Once all the urine has drained, they simply remove the catheter. Most patients who have no issue with memory or with manual dexterity will be able to learn the technique of intermittent catheterization. In some patients with obesity or with difficulty bending or with prostatic obstruction or other urethral stricture disease, this may be difficult. But in general, once we've seen a patient in clinic, we can assess their suitability for intermittent catheterization and can help them learn the technique in clinic if it seems reasonable. One of the biggest benefits of intermittent catheterization over continuous catheterization is that there's actually a lower risk of urinary tract infection with intermittent catheterization. There's also going to be a slightly lower risk of development of urethral stricture disease when passing an intermittent catheter over having a continuous catheter in place, and there's definitely a lower risk of urethral erosion when using intermittent catheterization over continuous catheterization.